Ready.
Okay, get start. Rolling?
Yep.
All right, so now we're going to put airway and airway adjuncts. For an adult, you want to use the head, tilt, chin lift, fingers under the lower bony part of the jawbone here, hand on the forehead by extending the neck. This way it allows the windpipe to open. So we're trying to extend the head and neck again to open this airway by stretching out the windpipe. This draws the tongue away from the back of the mouth. Head, tilt, chin lift. If the person has some kind of spinal restriction or spinal injury, we would use the modified jaw thrust, placing most of the pressure here against the zygomatic arch, lifting the bottom of the maxilla, just lifting the jawbone up, thereby trying to create this straight alignment by pulling the tongue away from the back of the throat and aligning the trachea again. Once we have this airway secured, we can also use the tongue jaw lift by placing your thumb into the jaw, lifting the thumb up so that you can insert an oropharyngeal. You can also use the cross finger technique by twisting the finger and opening the opening between the dentures or teeth. We would use an OPA that's properly sized. We'd use the corner of the jawbone down here to the corner of the mouth or the tip of the earlobe. This seems to fit. Use the tongue jaw lift. I'm going to insert 180 degrees or 90 degrees and rotate this as I keep the tongue in place. The flange will rest directly on the mouth. If this person has a gag reflex, we'll just take it out. The nasopharyngeal airway is for somebody that may not be able to take an OPA. We're going to measure this from the tip of the nose to the angle of the jawbone and tip of the earlobe, as well as measuring the patient's diameter of the pinky finger. Usually it goes in the right side. We use a water-soluble lubricant, lubricate the tube. We'll pug the nose so that the nose will open up a little bit, and we'll introduce the nasopharyngeal airway. We rotate this ever so slightly back and forth and slowly secure the flange against the nostril. This will keep the tongue away from the back of the throat, similar to the OPA. If they have a gag reflex, then we'll pull it back out. If for some reason this does not want to go, we'll stop and we might go to another device. Okay.